I greatly respect the Secretary of State, and as an older person who relies on NHS, I support his radical zeal. But may I quote what he said in his statement? Cancer is more likely to be a death sentence for NHS patients than patients in other countries. Now, we've had this conversation before, but can he at least look at other countries and their health systems, particularly the Netherlands and Australia, France and Germany, which, whilst protecting the vulnerable and having wonderful health systems, have a mixture of social insurance, public and private, to maximise inputs into the health service? Will he at least look at these models?
Madam Deputy Speaker, every time the right honourable gentleman praises my zeal for NHS reform, people on my side get very nervous. And let me reassure him, though. Look, I have looked at other countries, and I'll definitely continue to do that, and that's the reassurance I give him. I genuinely don't think it's the model of funding that's the issue, the publicly funded public service element. I really don't, and I hope he knows me well enough that if I did think that was the case, I'd be more than happy and would quite enjoy taking on the argument. But I think the equitable principle that underpins our NHS is one that we should cherish and protect, and the single payer model has enormous potential for the century of big data, AI, machine learning. There's huge unlocked potential there that we must unlock, but that doesn't mean we can't learn from the way in which other countries organise models of care, particularly in the community, particularly in social care. I met this week virtually with my friend, the Health Minister for Singapore. I'll continue to work with my international counterparts to learn from other countries whose health outcomes are far better than our own.